Hello, I'm Dr. Les Grosinger. I'd like to take a few minutes of your time to discuss cataracts and what can be done about them. Simply put, the human eye is very much like a camera. It has a lens like a camera, and it has film like a camera. The film of the eye is known as the retina, and it is in the back of the eye. The lens of the eye is behind the pupil. As people get older, often the lens becomes cloudy. In fact, this is a uniform development in all people after they reach the age of about 50. Once the clouding of the lens causes symptoms like blurred vision, difficulty reading, or glare and halos, making it difficult to drive at night, consideration should be given to removing them. In younger people, cataracts develop as well, but often they have underlying medical conditions like diabetes that make them more likely. About 60% of the people I operate on are over the age of 65, but that still leaves a good 40% under the age of 65. For more than 20 years, I've made high-level cataract surgery the focus of my surgical practice. These days, it's not enough to simply remove a cataract. With technologies such as specialized lens implants to correct astigmatism and laser-assisted cataract surgery, my goal is to not only improve vision, but if possible, to make it even better than it was before the cataract developed in the first place, and possibly even better than it's been for many decades. By this process, I hope to minimize one's dependence on eyeglasses as well. I'm proud to say I have many thousands of patients who can attest to this. I'm also pleased to say that the procedure remains painless, usually takes about 5 to 10 minutes to perform, and results in rapid return in vision. In addition, the risk of surgical complication in my hands is extremely small, well under 1%, making this one of the safest procedures ever. My mission as a state-of-the-art eye surgeon is to provide my patients with the very highest level of cataract surgery available anywhere in the world to ensure my patients achieved the very best vision possible. I hope this information has been of value to you. My staff and I are always happy to answer your questions. Thank you.
Hi, I'm Jerry Amster. I'm an internationally published photographer of the best resorts in the world. Before I saw Dr. Grosinger, I was having trouble focusing my camera, seeing pictures clearly, and colors weren't as bright as they could have been. I thought it was my camera or my eyes, the filter on the camera, whatever. Dr. Grosinger examined me and found that I needed cataracts removed. Well, and I need my eyes for my photography. Okay, so I talked to other people and they said nothing to it. Well, we went into the surgery and the surgery went on the first eye went beautifully. I couldn't wait to get the second one done. I could see so clearly out of the first one. I got the second one done. The staff was terrific. It was absolutely without any discomfort, which anyone worries about. And now I don't have to clean my lenses on my camera anymore as I did. I see clearly, and colors are better than ever before because Dr. Grosinger whispered to me after the surgery, "Jerry, I've seen your photography and I put in a special UV filter in your eyes." Wow, it makes a difference on my camera. It made a difference in my eyes. And thank you, Dr. Grosinger. Beautiful.
My name is Jeannie Dudley. I had been having a lot of problems with seeing. I always thought I had something in my eye, night light. It was just horrible. Couldn't read anymore like I normally do. She told me I had cataracts. I couldn't believe it because I thought I was too young for cataracts. She says the cataract in my right eye was really, really bad. So I asked her, if you were going to get this surgery, who would you go to? And she told me Dr. Grosinger. I said, okay. Made an appointment, got in right away, saw Dr. Grosinger. He explained to me what he was going to do. It sounded a little scary, but I trust that he knew his job and that I would be okay. Had the surgery done, one eye, then 2 weeks later had the other eye, I cannot tell you how much a difference this has made for me. I don't have to squint. I don't always feel like something is in my eye. I can read like I normally do, since my world kind of came back to me after the surgery. So I applaud Dr. Grosinger. I loved it. I wish I hadn't waited so long to get this cataract surgery, which I didn't know I had, but I did. I loved it.
My name is Linda Huey. I was referred by my optometrist. 2 years ago, she told me that I had the beginnings of cataracts. And when I went back just a few months ago, she said that they were worse. And I said, well, let's get something done here. Let's see if we can't get something fixed. I said, who would you recommend? And she said, Dr. Grosinger. So I went home and looked Dr. Grosinger up because I was concerned about who was going to take care of my eyes. And Dr. Grosinger is rated #1. So I decided that he would be the one that I would want to take care of my eyes. And went in and had the procedure done. And I was in and out in 3 hours. In fact, I'm more nervous right now than I was when I had the surgery done. So right after the surgery, I went and had breakfast with my husband, and the next day it was business as usual. My eyes weren't scratchy, I didn't have any headaches, there was no soreness, there was no dryness, it was just perfect. I can see better right now than I could when I was a teenager. I would recommend this highly to anyone that is thinking of having cataract surgery. I've been so happy. A side note here is that I know that I was not Dr. Grosinger's only patient the day that he did surgery on me, but the staff there, and he made me feel like I was the only one, which was very reassuring. Thank you, Dr. Grosinger.